Hey everyone, it's Johannes with Super EC NCLEX. I'm here with Dr. Martinez. We'll be talking about beta blockers today. Keep it real simple, straight to the point, so you guys know the key things that you should be aware of when we're talking about beta blockers. Just remember, beta blockers all end with LOL, right? Just remember that, LOL. So we have metoprolol, right? Metoprolol, right? So you see it right there. Labetalol, correct? Law. And so just keep that in mind, guys. They all end with LOL, right? And I'll let Dr. Martinez just kind of walk us through the beta blockers.
So beta blockers are a group of medications that are mostly used for hypertension treatment and abnormal heart rhythms dysrhythmias. As Luna mentioned earlier, they do end with the letters LL, which is a good thing to remember for your NCLEX. Beta blockers pretty much are able to treat these conditions by attacking certain receptors on smooth muscle, both found in the heart and in vessels. The house it helps to lower your blood pressure and to control abnormal heart rhythms. Okay.
So the other thing that I wanted to go over, and excuse my terrible writing, is the other types of contraindications that we should be aware of when we talk about beta blockers. So one of the contraindications will be the heart rate, right? So a heart rate that is less than 60 beats per minute is a big deal in the NCLEX, right? The other thing that we worry about is someone that has hypotension. Okay, so as much as we want to worry about the heart rate, we also have to be aware about a patient that's hypotensive, because the NCLEX may not even ask you about the heart rate. They may just tell you a patient has a heart rate of 80 over 40, and they'll say, would you give this medication? Of course, we will not give that medication. So just be aware of the heart rate, number one, right? And the BP as well. And the other thing we worry about is patients that have asthma, right? So respiratory problems, because beta blockers can cause vasoconstriction within the lungs, correct?
Exactly. And as the patient's presenting, let's say, not only asthma, but as well as COPD, the reasons why they're presenting is because they're having vasoconstriction. So giving them a beta blocker when they're already constricted can just make the situation worse and can put them into severe respiratory failure.
Okay, so that's the big problem, right? So asthma patients can go into severe respiratory failure, right? And just keep in mind that there's also a medication to treat, I believe it's glaucoma, correct? And it actually is a beta blocker, right? So if you have a patient that has, um, you know, let's say low heart rate, so or they have issues with their blood pressure, and you're administering this medication to treat their glaucoma, and it is a beta blocker, and it does end with LOL. So we're going to be very concerned if our patient has bradycardia or they have hypotension, and we're about to also administer these eye drops to treat their glaucoma. Okay,
exactly. Yeah, and these patients will present basically with complaints of some sort of eye condition, and you will be asked by the physician to possibly put these eye drops, right? The most commonly used medication is called timolol. But as a nurse, your job is to make sure those vitals are stable. If you do see that the heart rate is less than 60, you do not want to administer this medication because, again, this will cause a drop in the heart rate and they will drop below 60, which is considered an abnormal heart rate.
Okay, so let's just do a quick review of what we talked about, okay? So again, beta blockers end with LOL, right? Very simple, straight to the point. They all end with LOL, okay? They are used to treat hypertension, right? Hypertension, abnormal heart rhythms, okay? So abnormal, I'm gonna just try to keep it quickly here, abnormal heart rhythms. And glaucoma is one of them. Okay, so just remember that. They all end with LOL, treat hypertension, abnormal heart rhythms, glaucoma. Okay. We worry about Okay, so contraindications, right? We worry about a heart rate that is less than, give me a second here, 60 beats per minute. Okay, if you have a patient that has hypotension, give me a second here, sorry about that. Hypotension. So those are the main two things the NCLEX is going to worry about. And then also, the most important also that you can't forget about is a patient that has asthma. Okay, bronchoconstriction can occur with beta blockers, and the reason for that is why, Dr. Martinez, because beta cells are also located where?
In the smooth muscles in your lungs. And don't forget also COPD. You see this in a lot of older patients who have a prolonged history of smoking.
Okay, so beta cells in smooth muscles of the lungs, right? And they're also located in the heart. Is that correct?
As well, and throughout your body, through the vessels, veins, and arteries.
All right, so that's the reason why when we're giving these beta blockers, we already have beta cells. They're causing a blocking effect, right? So that we are doing something in the body in order for them to function and prevent the I don't know what's the best way to word it, how the beta blockers work in the body with the beta cells.
So the beta blockers pretty much will settle in these receptors, which are the beta receptors. There's also alpha receptors. And when they settle in these receptors, they will cause release of certain molecules that would then relax the muscle. Many times they might relax, many times they might constrict. So those are things that you might not have to know in details, but just knowing a little bit of how they work will help you figure out the side effects and when this medication should be used.
All right, guys. So that's pretty much it. We kept it simple, straight to the point. If you have any questions, please leave them in the comment section. Please subscribe to our channel and share our videos with your friends. That way we can be noticed on YouTube, and we are here to help you guys with anything you need. Any questions you have, please send us a comment, or you can reach us at info@supereasynclex.com. Again, I am Johannes Luna. I am a registered nurse, and this is Dr. Martinez.
I'm a board certified emergency medicine doctor.
All right, and I am a trauma certified ER nurse as well. All right, so we both are ER experienced. We have plenty of years of experience behind us, and we're here to help all of you reach your goals of becoming licensed as registered nurses. Thanks.
Please reach out if you have any questions.
Thank you.
Bye.
Bye.